Thanks so much. It's a pleasure to be here. One of my most favorite things to do is to spend time with my Rupa Health family. Love it. I'm talking a lot about the gut's effect on cardiovascular. So many patients forget that cardiovascular disease is the number one killer in America today. I'm going to share some insights, going to go over some things. Please, everybody, I'm going to leave ample time at the end for questions. I love at least 15 minutes of questions, open-ended, extemporaneous, ask anything, even if it's not on this subject matter. If I can answer it, I will definitely answer it. If I can't answer it, we'll get that answer for you. And without further ado, I'm just going to pop my video off for a little bit. Guys, I'm fighting a really bad cough, so if I cough, I'm apologizing in advance. So let's dig in. Let's talk about the gut matters, revealing the connection between the gut and cardiovascular health. So when the gut microbiome is out of balance or inflamed, the impact is felt throughout the body, including, believe it or not, the cardiovascular system. If the gut is healthy and functioning properly, microbial metabolites, most precisely lipopolysaccharide, LPS, and other antigens are appropriately contained within the gut lumen. Unfortunately, a dysfunctional permeable intestinal barrier, i.e., leaky gut, allows microbial antigens and metabolites to be translocated from the gut into the bloodstream. Once intestinal permeability allows LPS and antigens to escape into circulation, they can trigger immune response inflammation that contributes to insulin resistance, hypertension, atherosclerosis, coronary heart disease, and cardiomyopathy. I'm going to try to explore some cutting edge research trying to define the gut microbiota's pivotal role in maintaining and damaging cardiovascular health. I believe this exciting realm of therapeutic interventions that target the gut microbiota to optimize cardiovascular outcomes will really be illuminating for all those who listen. From probiotics to prebiotics to personalized dietary and lifestyle modifications, I'll try and share some innovative strategies that may offer some promising avenues for manipulating the gut microbiota composition and its true functionality on the body and whole. Lastly, I will share some detailed clinical approaches and treatment protocols for restoring damaged barriers, eliminating gut dysbiosis, and of course, cover the idea of testing and not guessing. Which tests are we going to use as a baseline for our particular cardiovascular and gut issues? So let me dig right in. And 2,000 years ago, approximately, Hippocrates once said all disease begins in the gut. Alessio Fasano in the year 2000 said aptly, all disease begins in the leaky gut. They were both right. The gut is 80% of our immune cells. It's where our macro and micronutrients are absorbed. I believe the gut is a doorway to our health if we take proper care of it. So diseases are associated with dysbiosis. Let's define dysbiosis, unleveling of good and bad bacteria. You need about 85.1% good bacteria not to have dysbiosis. There are no days off when it comes to your gut health. Abnormal changes in the composition of dysbiosis is possibly associated with pathogenesis and propagation of heart disease, atherosclerosis, hypertension, obesity, type 2 diabetes, and a lot of gastrointestinal disorders. All disease, as we said before, begins in the gut. So let's look at a mechanism of gut permeability and mediated low-grade endotoxemia. So this is fascinating. We could spend a large number of moments going over this, but let's just really look and hone in on the idea of these tight junctions. So here's an epithelial cell. Here's an epithelial cell. They come together. They form what we like to refer to as a tight junction. So when the junctions are compromised from an elevation in zonulin, which is a functional pull on the junction, so it loosens up a little bit, these fingers are depicting something called occludin, which are the structure of the tight junction. So if you get an elevation of zonulin and an elevation of occludin, you have a tight to a loose junction. In that tight and loose junction, it's been called leaky gut, but some other things occur, like an endotoxin called LPS can get through the tight junction. So that's the idea of mediated low-grade endotoxemia. So translocation of LPS into the systemic circulation has a negative effect on body homeostasis shifting the host immune defense to pro-inflammatory state, which has been shown to predispose to atherosclerosis. This slide is very interesting in that whatever attack goes through the gut gets to the liver. So the liver and the gut are bidirectional. Whatever you do to your gut, you do to your liver. Whatever you do to your liver, you do to your gut. So LPS that's escaping through increased intestinal permeability gets to the liver to be broken down. Now, if your liver is dysfunctional, you have a greater amount of LPS floating in your body. LPS is going to be the backbone of why we have such an increase in cardiovascular disease when it's attributed to, i.e., leaky gut. You can see here some mechanisms of LPS-mediated atherosclerosis. There'll be some succeeding slides that I'm going to share with you that will really show the concept of LPS increasing the incidence of heart disease. As a matter of fact, the exact number is the expression of LPS when you can test for it, and it's shown to be positive, increases the incidence of heart disease by 3 times. So here's your trifecta, if you will. Here's your altered gut barrier function. Here's your bacterial overgrowth. And when we talk about bacterial overgrowth, we're talking about small intestinal bacterial overgrowth, i.e. SIBO, and we have an impaired host defense. All of this can lead to bacterial translocation. A little note, everybody knows I'm a chiropractor and we have a lot of manual therapists on the line today. Bacterial translocation has been implicated as one of the leading causes for disc herniation. As a matter of fact, a study revealed that 52% of people who had surgical disc interventions had so from bacterial translocation. So, in layman's terms, that bacterial translocation came from the gut. So, there's a direct gut to disc axis or gut to disc pathway, if you will, from bacterial translocation. Bacterial endotoxemia, i.e., again, and LPS, enters the bloodstream. LPS is without question got a great nickname. I refer to it as El Diablo. Both bacterial translocation and LPS leads to the activation of monocytes and macrophages and the release of pro-inflammatory mediators. Here we have the tie-in of the heart and the gut. Patients with inflammatory bowel disease appear to have a higher risk for coronary heart disease despite a lower prevalence of classic risk factors, indicating links between the gut and the heart. So there's a direct correlation between the heart and the gut. So triggers for increased intestinal permeability, interestingly enough, this is a list, but this does not incorporate everything that you conceivably think about. Number one that you would look at is antibiotics. Antibiotics are nuclear weapons, without question. They blow up all good and bad bacteria. They, without question, blow up an array of different types of bacteria. So I'm not anti-antibiotic, if you will. I think they have their place. I just like to share that with people that if somebody takes a dose of 5 to 10 days of antibiotics, you usually blow your gut up or need about a 6-month succession of pre and probiotics to repopulate all that's lost. Bacteriophages are vastly different than antibiotics in that they kill one bacteria. They're like a sniper to the nuclear weapon of antibiotics. Acid blocking drugs, PPIs, proton pump inhibitors. This is very disconcerting to me as a practitioner. I see so many patients walk in. They're supposed to be used for 4 to 6 weeks. They're typically used for 4 to 6 months, years, and even in several decades. They lead you down a slippery slope of increased leaky gut and increased compromise of the blood-brain barrier. NSAIDs, non-steroid anti-inflammatories. They do decrease pain, but they impair healing. Nutraceuticals decrease pain and promote healing. Which do you want? So NSAIDs obviously are very deleterious to one's overall barrier function. Heavy metal exposure, environmental toxins all lead to compromise of barriers. Concussion. 60% of people that have a concussion have a gut issue, whether it be leaky gut or small intestinal bacteria overgrowth. Cesarean births also enable the child to be exposed to a different bacteria on the skin, Staphylococcus, versus what's in the vaginal flora, which is usually Lactobacillus acidophilus. As I said earlier, the gut to liver is bidirectional, so liver toxicity can also be a byproduct of leaky gut, gut dysbiosis, and I believe one of the hidden reasons for chronic inflammation is food sensitivities. Food sensitivities, the only real way for us to ascertain if you have a food sensitivity is to test, because there's a 72-hour symptomology delay, 3 days. So today is Wednesday. If my patient ate something Wednesday morning, how would they know Saturday that what they ate Wednesday was lighting them up? And how would I, as a practitioner, understand what they ate Wednesday is the reason they have inflammation and symptomology on Saturday? One way. You'd have to test for that. Whereas a food allergy, it's pretty quick and sometimes even anaphylactic. Yeast bacteria overgrowth. Candida has been implicated in most yeast overgrowths. 97% of yeast overgrowths are attributed to Candida. We call that small intestinal fungal overgrowth. Chronic stress, sleep deprivation, chronic inflammation, alcohol. Without question, I'm a big proponent, no gluten, no dairy. Limit your sugar, especially your added sugars, artificial sweeteners. And I think one of the hidden reasons for leaky gut is food additives and emulsifiers. I could spend all day here on my Dr. Rob's gut matrix, so let me give it in an epigrammatic fashion. When we talk about your gut, we're talking about the small and the large intestine. The small intestine is a misnomer in that it's really quite long. It's 90 to 95% of the length of the intestine. The average human has it about 22 feet. It's a single layer epithelial cell that has the thickness of a wet paper towel. I like to refer to it as the screen door. When that screen door is in pristine condition, things pass that are supposed to pass and things that are the body's supposed to be protected are protected from. When you have holes in the screen door, like leaky gut, tight junction damage, things pass the gut and get into the bloodstream. It has been stated that the first time the outside world meets the inside world is when something gets digested through the small intestine. It is your first line of defense. So food sensitivities, yeast overgrowth, dysbiosis all lead to leaky gut. An increase in leaky gut leads to an overexpression of toxic and chemical overloads, which can lead to liver dysfunction. 75% of your toxins go from your gut to your liver via the bloodstream. 25% go by the portal vein. Whatever you do to your gut, you do to your liver. Whatever you do to your liver, you do to your gut. Leaky gut has been implicated in increased blood sugar problems, insulin resistance, body composition, i.e. obesity. It has been stated over and over again that leaky gut is the doorway to autoimmunity. One of the number one reasons for that would be Hashimoto's disease. That is a great example. 75% of the patients that come in my office that have Hashimoto's have a gut problem. Again, I'm a chiropractor. The gut to joint, the gut to disc axis, which I alluded to before. When you have a leaky gut, you have an increased expression of cytokines. Those cytokines increase your incidence of arthritis and joint pain. You also have an increased expression of MMPSs, matrix metalloproteinases, proteolytic enzymes that are released at the time of injury that eat fibrocartilage. That's the reason that if you have leaky gut, you can damage disc because your disc is made of fibrocartilage, as well as your meniscus in your knee. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. Happy gut, happy brain, happy life. And lastly, there is the release of LPS, lipopolysaccharide. That release of LPS increases the incidence of cardiovascular disease by 3 times. Hopefully, this becomes a more evocative slide in that there is healthy cell junctions, there's healthy microvilli and good absorption. As you can see, the light-colored blue balls are able to pass through the pristine leaky gut, whereas the larger blue balls, which are large undigested food particles, are passed on to go to the large intestine, therefore to be eliminated. Conversely, damaged cell junctions, which imply tight junctions with now loose junctions and damaged microvilli, which are your finger-like projections, which are critical for grabbing nutrients for absorption, are damaged, and therefore, ultimately, both blue and the white-colored balls, the small digestible food particles, and large undigested food particles get through the gut. That expression of large undigested food particles can lead you down a path of localized inflammation, systemic inflammation, and ultimately autoimmunity. Diet and lifestyle can lead you down an inflammatory path. Essentially, antigens get through that leaky gut. Those transmigrations of antigens lead to an immune response where you have B and T cells, and you have the start of autoimmunity through the gut. It's become very clear to everybody to test for a gut barrier or anything that damages the gut barrier is really a baseline test in any of our offices at this point. Common food additives can impact the gut bacteria. Food additives, i.e., emulsifiers, actually drive intestinal inflammation. KBMO offers what they call the triple screen. I love it because it's the trifecta in that it has a food inflammation test, which we're going to discuss in the succeeding slides. It's called the FIT 176 test, where obviously it tests for 176 different foods, additives, and emulsifiers. It's also an immune test because it's testing the gut barrier panel. That gut barrier panel is your entryway between the outside world and the inside world. And lastly, they've just added the cardiovascular inflammatory test. So therefore, they're testing cardiovascular health. So they're testing food inflammation, leaky gut panels, and cardiovascular. And you'll see the triple threat. It's all this beautiful Venn diagram. So let's talk about IgG and C3D for food sensitivity. We all know that food sensitivity is based on IgG. Where I like to say that KBMO kind of hangs their hat on is they do two things. They do IgG, not just 1 and 2, they do IgG 1 through 4. So there are 4 subtypes of IgG. That third IgG, which is IgG3, is only 7% of the IgGs, but it's a critical one because it enables you to test for the complement cascade. Now, IgG is a B cell test coming from your adaptive immune system. I never realized till I got into food sensitivities that when you produced a lot of antibodies, or too many antibodies conceivably, you would also need to produce inflammation to ameliorate a lot of these antigens and foreign particles. C3D is the most stable inflammatory molecule in the body. It's part of the complement cascade, and it's part of the innate immune system. So when you're testing for IgG and C3D, you're testing for both ends of the immune system, if you will, or the innate and the adaptive immune system. It's a dual technology, which really gives an advantage to being more accurate and having a better confidence interval within foods. So food sensitivities, their effect on health, systemic inflammatory response, skin reactions, joint pain, muscle pain, GI symptoms, brain fog, anxiety and depression. Now, interestingly enough, in an IRB study, the number one set of symptomologies that decreased from just removal of food sensitivities was anxiety and depression. Number 2 was gas and bloating and brain fog. So all those mental health considerations that we have to look at now, you can get them from, or you can help them from removing specific food sensitivities. In addition, food sensitivities have a direct play into neurodegeneration, autoimmune issues, fatigue, body composition, and cardiovascular issues. People with food sensitivities have a higher risk of cardiovascular disease. Many experts agree changes in the gut microbiome from food sensitivities can affect a person's cardiovascular system. I use this slide a lot. We could spend all day with this slide. The bottom line is when you stimulate your complement cascade, you're stimulating inflammation, and there's going to be inflammatory symptoms. One big takeaway, conversation piece. Look at the left side of the gut, that the gut is leaky. There's things that are passing between the tight junctions. Look at the right side. That right side is small and thinner. That right side has autoimmunity. Here is the salient point. If you have autoimmune symptomologies in your fingers, in your hair, on your skin, you could conceivably have those autoimmune issues at the gut level. If you do, and you combine these tests with an inflammatory test or a standard blood serum test, and you find out that they have autoimmunity at the gut level, it's going to take a long period of time to get over that hurdle. And I think that we assume that the gut may be leaky, but there's no other damage to the gut, and that just may be wrong. So the FIT test, basically it's the dual technology. So it's a dual pathway. So you see on the left, many companies use a single pathway. They use IgG 1 through 2. Once again, KBMO is using IgG 1 through 4 and C3D. So they're testing both the innate and the adaptive immune system. So here is the results of an IRB study. So basically Food sensitivities were removed, and a visual analog scale was used for abdominal pain, gas and bloating, bowel habits. The interval group beat the control group by 3 times. Homocysteine, a stroke marker typically attributed to inability to methylate appropriately, actually decreased dramatically versus the control group, which actually increased just from the removal of food sensitivities. And C-reactive protein, which is a tissue inflammatory marker, also beat the control group by 5 times. So the removal of foods in an IBS study really showed the decrease of inflammatory markers dramatically. Now, why do I like the fit test so much? I like the fit test because it's easy. It's color coordinated. I can interpret it easily, and I can elucidate this interpretation to patients quite easily. Look at the red. The red says +4, high inflammation. Stop. Then you have orange. You need to chill on the orange ones, which is +3. And the yellow, go, yield, handle with care. So yellow would be 2, orange would be a 3 on the inflammation, red would be 4. The lime green, you can continue with the lime green unless you have excessive food sensitivities. And obviously green go. And now you're seeing the list on the right side of aspartame, saccharin, and the such in food additives. People ask, why do we test for increased intestinal permeability? Great question. I ask chiropractors, do you do x-rays? Doctors, do you do MRIs? Every doctor has a baseline. This is a great baseline. This should be a baseline in all our office armamentariums. In that also, it also shows the beginning. So you test, you treat, and you reassess. And I think testing for increased intestinal permeability is a great choice. The real question is, what and when does a provider want to order a KBMO barrier panel? We have food sensitivities, IBS, IBD, clearly celiac, SIBO, small intestinal bacterial overgrowth can cause leaky gut. Leaky gut doesn't always cause small intestinal bacterial overgrowth. Post-concussion, digestive and skin issues, weight loss and gain, autoimmune conditions, whether you have joint or disc injuries, the panacea guys, chiropractors, you got to start looking at the gut, brain fog, fatigue, neurodegenerative disease, ASD. 90% of people that have ASD/autism have a gut issue, according to a 2019 study. Liver dysfunction, blood sugar issues, and of course, cardiovascular. And the bullseye that's missing there, the condition that causes the second most loss of days from work, migraines. So the interpretation of the gut barrier panel, let's look at Candida, zonulin, occludin, and LPS. Candida is a yeast. We talked about that before. I gave the example of what zonulin was, a protein enzyme that pulls on the structure of the tight junctions. Occludin is the fatigue and the tearing of the structure. And LPS is something that is an endotoxin that holds gram-negative bacteria on the inside of the intestinal wall. So you have IgA, which is positive for Candida. IgA antibody implies at the mucosal level, usually gut level, gum level, lung level, and it's an early onset antibody. IgG 1 through 4 is a more involved antibody. That's an antibody that's the most popular. 75% of the antibodies come from IgG. It's also quite small. It's able to pass the placenta and get to the fetus, but it usually takes about 21 days. C3d implies that innate immune system has been activated. So Candida is damaging the gut level. It's also been around and elevating inflammation for a while. Zonulin is positive and at the gut level, so it hasn't been around long enough to damage the occludin or elevate the occludin. And LPS is positive over a duration of time. This person's got some issues that needs to be addressed. So Candida, as I said before, type of yeast that lies in small amounts in different parts of the body, mouth, skin, and gut, grows when bacteria is suppressed or their immune system is weakened. You will see a correlation between the elevation of Candida and dysbiosis. Zonulin, when you look at the little statement on the right, gliadin and bacteria stimulate zonulin release. So when people say gluten, you can't eat gluten, especially in America. Zonulin, and I believe that zonulin is a longevity marker. I think it's a standard marker that we should use in all our blood tests. It is a protein synthesized in intestinal and liver cells. It's a key biomarker for intestinal permeability. It's the only reversible regulator of intestinal permeability. It has elevated levels of zonulin is associated with this list of conditions: autoimmune, celiac, adult glucose intolerance, inflammatory bowel, non-celiac gluten sensitivity, even obesity, RA, type 1 diabetes, multiple sclerosis, and so on. Whereas a higher level of zonulin has also been associated with a higher waist circumference, diastolic blood pressure, fasting glucose, and increased risk of metabolic disease. So it is fair to say that zonulin damaging the gut leads to a cascade of issues that are not really health promoting. Now, a lot of people, we always argue about the zonulin, and it's an interesting thing that some people say zonulin elevates during the day. Let's be specific in the antibiotic or antibody type of zonulin. We're eliminating cross-reactivity because we're using a unique recombinant zonulin protein, which eliminates haptoglobin, propidine, and complement fragment cross-reactivity. Positivity rates also eliminate zonulin blocking and low positive rates. The bottom line is the sample size, the sample type. Too many people rely on stool samples for an accurate zonulin. It has been shown that it is serum and blood spots that are much more accurate for the diagnostics of zonulin. And a lot of people ask, let's cut to the chase. They say, hey, I get the serum, but I don't get the finger spot. What's the deal? NIH did a study and said that the blood spot was a statistical tie to the blood serum. And in reference to the blood spot, I love utilizing the blood spot because, one, I can't draw in New York, I can draw in Connecticut. Number two, it's very easy, it's very safe. And number three, with all the virtual consultations I'm doing now, it enables me to send it to a patient's house and they can get the test without having a phlebotomist come. So as we talked about occludin before, it's a key protein tight junction. It's a key marker for intestinal permeability. This has to elevate after zonulin elevates. For me, a clinical gem is occludin is essential in tight junction, stability, and barrier function. Together, zonulin and occludin, they are Batman and Robin for the tight junctions. They're the gatekeepers of those tight junction proteins. When they function properly, they actually prevent anything from getting outside the gut into the bloodstream and stimulating a cascade of inflammatory responses. LPS. There is LPS, lipopolysaccharide endotoxin. LPS attaches to toll-like receptor 4. Toll-like receptor 4 stimulates MyD88, which stimulates NF-kappa B, an inflammatory signal transducer, which almost always releases specific pro-inflammatory interleukins. In the duration of its travels, NF-kappa B from the stimulation of TLR4 also damages mitochondria. One of the biggest reasons that we have mitochondrial dysfunction and mitochondria leading to fatigue is because our gut is compromised. There is a second signal of the NLRP3 inflammasome as well, which is pro-inflammatory. So obviously, what would we do to decrease this activation? Well, keep LPS in the gut. Unfortunately, patients come to us with people floating around with LPS. Omega-3 fatty acids, alpha-lipoic acid, is the secret sauce to prevent the activation of LPS to toll-like receptor 4. And signal 2 in the NLRP3 inflammasome, it's ketone bodies. Unfortunately, if LPS stimulates toll-like receptor 4 and stimulates all this pro-inflammatory havoc, if you will, toll-like receptor 4 also stimulates toll-like receptor 2. Toll-like receptor 2 is the atherosclerotic pathway. So now you've got plaquing, and you've got plaquing with inflammation. It's no surprise that the release of LPS or the expression of LPS increases heart disease by 3 times. LPS, toll-like receptor 4, MyD88 activates NF-kappa B, releases cytokines. LPS major outer surface membrane components present in many gram-negative bacteria. 80% of these gram-negative bacteria are pathogenic. They're strong stimulators of the innate immune system. They're an endotoxin. They release a lot of inflammatory cytokines. They can cross the blood-brain barrier. Please make note, LPS is present in triglyceride-rich VLDL, and LPS is a component of biofilms, the bacteria igloo. The example of a biofilm in our gut is plaque in our teeth. Those biofilms, those bacteria igloos, are so present now The NIH has said that 80% of bacterial infections in the gut have a biofilm. So you all need to use a biofilm buster to break apart these biofilms and use something like serum bovine immunoglobulin to mop it up. LPS is interesting in that when LPS is inside the gut, it is quite anti-inflammatory because it stimulates interleukin 10, which conversely downregulates interleukin 1, 6, and interleukin 8, which are pro-inflammatory. However, conversely, when LPS is expressed outside the gut, interleukin 10 is turned down, so the anti-inflammatory effect of LPS is inverted and all the pro-inflammatory occurs outside the gut. LPS can be associated with joint, thyroid, brain, lung, metabolic disorders, immune modulation, and even muscle. So gut permeability ultimately leads to endotoxin absorption or extra endotoxin absorption. So what do you do if you have an LPS, or what do you do if you have this increased intestinal permeability? I like my 7R action plan. If anybody's interested, I detail it in full length in my book, Immune Reboot. So the first R you're going to adhere to is the reset. You're going to reset your diet, your lifestyle, and your mindset. Your mindset is health is wealth. Your diet, obviously, it's N of one. I'm going to find the right diet for the person in front of me. Generically speaking, ketogenic diet's a great choice. Flexitarian diet, Mediterranean diet, and the such. We're going to make diet, lifestyle, exercise, 6,000 steps a day a critical start. The second R is remove. We're going to remove what? Unwanted pathogens. This is the one where we truly address food sensitivity. You're going to remove those food sensitivities out. You're going to remove GPS, no gluten, no processed food, no added sugar. You're going to remove DNA, no dairy, no nicotine, no artificial sweeteners. You're going to remove the other pathogens by using oregano oil, berberine, garlic, serum bovine immunoglobulin, biofilm buster, and you're probably also going to support your liver pathways. Your third R is where you replace. Replace with what? Digestive enzymes, stomach acid, pancreatic enzymes, and maybe the secret weapon, add bile flow, taurine or ox bile, because an increase in bile flow decreases dramatically your incidence of leaky gut and also decreases dramatically your incidence of small intestinal bacterial overgrowth. Regenerate, heal and seal the gut lining. You're going to use pleiotropic nutrients that are going to heal and seal the gut lining and also create an anti-inflammatory environment in your gut and enrich your so-called ecosystem. 5, you're going to reinoculate with pre and probiotics. It has been stated that the prebiotic may now be more important than the probiotic. An increase of fiber, which is a prebiotic, of 10 grams decreases your mortality by 20%. The average American only consumes 8 to 15 grams of fiber per day. We need 35 to 50. Let's up our fiber. Let's up our prebiotic. Let's have our prebiotic feed our probiotic to make our postbiotics like a short-chain fatty acid like butyrate. Reinoculate. So reintroduce, retest. Here's your opportunity to run the fit test again and or reintroduce foods. If you're going to reintroduce the food without the test, pick the foods that are lowest on the inflammatory scale because you need a 3-day reintroduction. So you'll get probably 2 to 6 weeks later the very high inflammatory foods. And lastly, you want to retain your health and GI integrity. Keep your diet, your lifestyle, and your mindset. There is no lottery ticket to health. You don't get it and you get to spend it all. You want to get it and keep it all. So here's some protocols that I would recommend if you have an elevation in candida, caprylic acid, oregano oil, berberine, garlic, serum bovine immunoglobulin, and probiotics lactobacilli strain. Probiotics belongum, zinc carnosine, L-glutamine, collagen peptides, curcumin, and glucosamine HCl oral if you see an elevation of zonulin and occludin. Let's do a quick case study. And I know I'm running a little late, but we're going to get to as many questions or all the questions. We've got a great crowd here. Gut barrier panel. We see that positive for IgA for candida, zonulin, and occludin, all at the gut level. And LPS was elevated for IgG 1 through 4, C3D. I did my 7R action plan. I did each part 1 month. I reevaluated 6 months later, and happily, everything turned back green. So everything was all negative. Took about 6 months of really high-level compliance. by the patient. So for me, the most effective outcomes of all disease spectrums can result from the normalization of gut function. So let's turn the channel. Let's flick the switch. Let's talk about early detection. Most people don't get tested until disease is already causing a problem. Early detection of biochemical markers allow for early intervention and ability to prevent diseases. 50% of heart attack patients have normal standard lipid profiles the day of the heart attack. Heart disease is the leading cause of death in both men and women. This is the case in the US and worldwide. Heart disease, like we said, is the leading cause of death. Only 49% of Americans got it right. More than half of America is still unaware of the leading cause of death. It was postulated by a health educator, and she said people may not want to acknowledge heart disease as a leading cause of death because many risk factors for heart disease require lifestyle modifications that are hard to do, such as losing weight, stopping smoking, and consuming a heart-healthy diet. Bottom line is, people didn't want to work hard, hence the idea of adapting to testing, not guessing, and putting the tenets of functional medicine into our chiropractic, into our nutrition, into our medical practice. Everybody, let's test, don't guess. Here's what's looked at and what is tested for in the cardiovascular inflammatory test. You've got, and you can use this, everybody has access to all my slides. What you're looking for is total cholesterol, direct, and that's a big differentiation, direct versus calculated LDL. I will go into detail why. HDL, triglycerides, non-HDL, ApoB. ApoB is the carrier of all the bad types of bacterial particles. Lp(a) is your genetic marker for heart disease, and specific lipid ratios. In addition, you're going to be testing for HSCRP, which is high sensitive C-reactive protein, acute inflammatory protein. You're really looking at inflammation in the arterial walls, glucose and hemoglobin A1C, and some other chemistries of homocysteine. Again, you have a definitive definition. I just want to highlight a few of them. Here's the KBMO cardiovascular inflammatory test. In that, you have advanced lipid testing. There's your list of direct LDL, HDL, total cholesterol, triglycerides, and the such, metabolics, and inflammation. Here are your ranges. Now, these are your standard ranges. It was interesting. I was having a discussion with an esteemed colleague. I don't know anybody who knows labs better than my friend. And we were talking about these ranges of normal. And he made a great point. Who gets blood tests but sick people? Yes, we're going to use these ranges, but you may have your own empirical ranges that you want to use on that you would want to base your patient base on as well. So why direct LDL? Direct LDL distinctly measures LDL. It makes sense. Most lipid panels do LDL cholesterol estimating equation involving other cholesterol measurements. So here is your calculated LDL. It's about a 20% difference with one of the most important markers. I want a direct LDL. This is a game changer already. This is already a feature that I can't do without. So ApoB, it's the single best cholesterol predictor of risk for heart disease and stroke. Every particle of dangerous cholesterol is wrapped by ApoB. Less than 5% of Americans have been tested for this. You should not go in and get a blood test, a cholesterol panel, without having ApoB, and less than 5% of the population has this. Lp(a), sticky lipids. That's where turbulence is in the arteries, like the glue, can cause blood clots that block arteries. Lp(a) affects up to 25% of the population. If you have it or you have a family member that has it, tell them to test their relatives because 40% of their relatives have the marker. Less than 1% of Americans have had their Lp(a) tested. This is your heart attack genetic marker. By the way, many people talk about statins, and I'm not negative to anything. Statins don't decrease Lp(a), they actually increase Lp(a). So here's a cholesterol, total cholesterol to HDL ratio, better indicator of plaque impact. HDL-C over triglyceride ratio, 70% plaque-forming patients have insulin resistance. 90% insulin resistance patients are underdiagnosed. So HDL-C to triglyceride ratio predicts this risk sooner than fasting glucose or hemoglobin A1C. Everybody's got all the markers that I shared with everybody there. High sensitive C-reactive protein, heart attack marker, condition associated with inflammation. Strong contributor from excessive fat stored in and around the organs, visceral fat. Visceral fat is that fat that's over your organs. It's vastly different than your superficial fat. It's extremely inflammatory, and it has a high correlation with increase of interleukin-6 and damage to the blood-brain barrier in the brain itself. It's also common in prediabetes. And here are your levels of high sensitive C-reactive protein. Glucose and A1C. Bottom line is fasting glucose is a snapshot at that moment. Hemoglobin A1C is your average blood sugar marker over 90 to 120 days, where it gives you also an emphasis of the last 30 days of about 50% of the test. Hemoglobin A1C is a standard bearer marker. Homocysteine, so interesting, homocysteine, normal breakdown of proteins. It's been associated with dementia, stroke, and the like. Typically, symptoms come when it's too late. It also is directly correlated with a inability to methylate with your MTHFR gene, whether you're under or over methylate. It's about 50% of the population, usually will lead to an elevated homocysteine. One of the easiest ways to decrease homocysteine is methylated B vitamins. Therefore, early detection and treatment is essential. So what supplements might help? So once we get through the supplement protocol and the case studies, we'll hit the questions. We should be there, aging in about 8 minutes. Dr. Rob's blood sugar protocol. Here we go. Low sugar diet. Limit your carbohydrates. Eat clean. GPS, DNA, we talked about that before. And alpha-lipoic acid. Alpha-lipoic acid is the only antioxidant that I know of that works with the watering of fat part of the cell. By the way, you'll see that this blood sugar protocol, you could mimic some of these things and you would have an Ozempic moment quickly. Alpha-lipoic acid, berberine, and a pre and probiotic with Akkermansia would be a great natural Ozempic moment. In addition, if you really wanted to decrease dramatically your blood sugar levels, you would also use chromium, taurine, acetyl L-carnitine, green tea, and of course, omega-3 fatty acids. Probably missing, and there's probably just not enough space, was vitamin D3. There's a receptor site on every cell in the human body for omega-3 fatty acids and vitamin D. So high homocysteine, we talked about that before. Methylated B vitamins, and if you have elevated blood lipids, add niacin, red yeast rice, phytosterols, panthenine, and a pre and probiotic. Your probiotic Akkermansia blowing up. The hot strain and Bacillus subtilis is an endospore, actually has great literature on helping and decreasing dramatically the incidence of Parkinson's disease. If you have an elevated LDL, this is not a full list, but this is just a list that you could adhere to. Niacin, omega-3 fatty acids, natto, multivitamin, multimineral, red yeast rice, vitamin D3 with K2, panthenine, phytosterols, and you could add my 7R action plan. Lower LP little a. Yeah, I know. I've heard a lot of stories that you can't lower it naturally. I don't know if I agree with that, and I think a lot of my qualified practitioners wouldn't agree with that. We've seen good results using L-carnitine, coenzyme Q10, ginkgo biloba, resveratrol, curcumin, flax seeds, and limit carbohydrates, of course. Combining exercise, get moving. Exercise is the backbone of our health, no pun intended. Will definitely decrease cardiovascular risk. Both resistant and aerobic exercises are needed. Here we've got another case study, gut barrier panel. We've got an elevation of candida in IgA and IgG and C3d, and increase of LPS. When you have that test, which is your fit test with your gut barrier panel, you combine it with your CIT results, where direct LDL, triglycerides, ApoB, LP little a, HSCRP, and hemoglobin A1C, where this person is just basically on the cusp of being a diabetic, are extraordinarily elevated. Here was the protocol that I used. I used a gut protocol modified 7R. For the first month, I used caprylic acid, oregano oil, berberine, garlic, serum bovine immunoglobulin, lactobacillus strain, GI restore formula, and I limited carbs. I switched to the lipid protocol months 2 through 6, niacin, omega-3 fatty acids, pro-resolving mediators. By the way, if you don't use pro-resolving mediators, you should. Pro-resolving mediators allow for the resolution of inflammation. Coenzyme Q10, resveratrol, natto, pre and probiotics, and again, 7R action plan. Let's take a look at the results. All clear in the gut barrier panel in 6 months. The CIT results, everything was within a normal range from direct LDL, triglycerides, ApoB. LP(a) went down from, I think it was 52 or 53 to 28. HSCRP, under 1 is a choice, but between 1 and 3 is very doable. Hemoglobin A1C dropped down from 6.4, if I recall correctly, to 5.2. Unbelievable. Under 5.4, there's no brain shrinkage if you're using hemoglobin A1C as your marker. Let's take a look at this case study. Here is a patient that had multiple approaches in statin therapy on a 2-year journey. He had an elevation of zonulin, and they had a tremendous elevation of LPS. So they took a gut barrier panel, they took a fit test, they took a CIT results. Again, everything elevated: direct LDL, triglycerides, ApoB, hemoglobin A1C, HSCRP, and LP(a), all elevated. The gut protocol, modified 7R first 3 months, pre and probiotics, polyphenols, omega-3 fatty acids, pro-resolving mediators, ketone bodies, GI Restore formula, and extra virgin olive oil. Lipid protocol, months 4 through 6, niacin, omega-3, red yeast rice, L-carnitine, curcumin, phytosteroids. And I continued with the modified 7R program. Everything all perfect in the gut barrier panel. And everything was within a normal range, an acceptable range in the cardiovascular inflammatory test. Again, hemoglobin A1C dropped to 5.3, LP(a). It can be done. These were very compliant patients, so they were able to get it done in a 6-month period, which is a short period of time. So some of the cardiovascular inflammatory advantages: a dry blood spot, validated against serum tests, 96% or more in agreement, stable for 14 days, gives patients another major screening tool to assess overall health and longevity. So this is my diagram, my flow chart: food inflammation test, immune health test with gut barrier panel, cardiovascular health test via CIT, all hitting the bullseye of health and longevity. There's your cardiovascular inflammatory test. It looks the same, literally, as your FIG test. There you have your blood spot. There's a tutorial, easy. You carry it in your office, you can work out of your home, you can drop ship it anywhere you need to go. So James was kind enough. James is the CEO of, James White, that is, the CEO of KBMO. Everybody, here is your ability to get the test at a discounted rate. Very quickly, I will share with you where you can get in touch with me. My Facebook, Instagram, I'm posting every day. I've got a podcast called Proven Health Alternatives.
Hi, everyone. We hope you enjoyed this class. If you're a practitioner, make sure you go sign up at rupahealth.com. And if you like this video, don't forget to like and subscribe.